All right, I think, welcome. We just have a few people online now. We're gonna wait just a minute to let
Wait a couple,
everybody join.
see 20. Maybe give it another minute.
All right, I think
Okay.
we should get started.
Okay.
All right.
Good evening, everybody. I'm Lauren Bernard. I'm co-president of the Brookline Parents Organization, often better known as the BPO, with Benjamin Kelly. And tonight, we're very pleased to be presenting an event called Navigating the Summer for Families with Unvaccinated Children. Some of you may be vaccinated yourselves, but your children are not, or you have one or two children who are, but younger kids who aren't. And a whole host of questions come up, and that's what we're going to explore tonight. Ben is going to introduce our panelists and moderator, and I will be back with closing remarks. Enjoy the evening. Thank you.
Hi, everyone. I'm Ben Kelly. I'm co-president with Lauren of the Brookline Parents Organization, and thank you all for joining us this evening. We're very happy to have some really amazing panelists and moderator with us this evening for this event. We have Dr. Natalia Linos, who is a social epidemiologist and the executive director of the FXB Center for Health and Human Rights at Harvard. We have Dr. Rosemarie Roqué Gordon, who's a pediatrician at the MIT Pediatrics, and she's been practicing in the Boston, Cambridge area for the past 15 years. And we have Dr. Vishakha Sabharwal, who's an assistant professor of pediatrics at the Boston University Medical Center, specializing in pediatrics infectious disease. And finally, our moderator, Dr. Amanda Tarullo, is an associate professor of psychological and brain sciences and director of the graduate program in developmental science at Boston University. So thank you to all of you for coming and sharing your expertise. I know that we've gotten a lot of questions ahead of time, and I want to say to everyone who's watching, feel free to add questions in the Q&A. We'll try to get to as many questions as we can. And this is also being broadcast and recorded on YouTube, so it'll be available afterwards. We'll share the link, so you can feel free to share it with friends and family and anyone else who you think would be interested. I wanted to say also that I think actually all four of our panelists and moderators serve on some kind of board, some kind of public health advisory board associated with the town, whether it's one of the advisory panels adjacent to the school committee or adjacent to the Department of Public Health. All of them are also Brookline parents, and they're here not representing those bodies in any official way, but representing themselves as parents and bringing their own professional expertise. So at that, again, thank you all for joining us, and I'll give it to Amanda.
Thank you, Ben. I'm honored to moderate this illustrious panel on a topic that I think is on everybody's minds this summer. And so we discussed it, and we decided that there are so many questions out there that we didn't want to have any sort of presentations. We wanted to just make the whole time be a question and answer session to give all of you a maximum opportunity to get your questions answered. And I know some of you submitted questions when you registered, but we also welcome your questions in the chat. What we're going to be doing is trying to organize our discussion around a few of the most popular topics. And so you're welcome to add your questions to the chat at any time, but I think it's especially helpful if you add them as we're on that topic. So we're going to start out tonight talking about what to do in different situations. So restaurants and camps and museums and people's debates about what is safe to do. And so we'll start out with some of those questions. Then we're going to move to talking about travel. And then we will be talking about concerns about variants and about vaccinations. And if there are other things that you want to know about, feel free to pop that in the chat as well. But just to give you kind of a roadmap, we're going to start out on what's safe to do or or how to reduce risk doing that, and then talk about those specific domains of travel, vaccinations, and variants. Okay, so let's start out. I just want to open up to our panelists with one of the questions, which was specifically about, is it safe to go to restaurants, to dine inside without masks for children who are under 12, so that they're not eligible to have been vaccinated. So people trying to make decisions about taking their children to public indoor spaces and whether that's safe. Dr. Gordon, would you be willing to start us off?
Okay, thank you. Thanks, Amanda. So I think that we talked a little bit about this beforehand as a group. Safe is a loaded word, so I think there are activities that are safer. And I think dining indoors with unvaccinated children is not the safest. We don't have a lot of circulation of COVID-19 right now in Massachusetts. We're actually really lucky in Brookline and lucky in Massachusetts, especially this part, the eastern part. But as things go, it's still not a super safe activity. So I would recommend dining in the outdoor part of a restaurant if possible. So I think that's where I would take that one. I would avoid crowded, like elbowing up to, a snack bar or something with unvaccinated children, unless, they're wearing masks while they're getting the food to go outside. But that's still, we know that initially in the early part of the pandemic, restaurants were a location where transmission happened. So I would say it's not the safest place. Outdoors would be better.
I can jump in to just echo what was just said in the sense, I'm a social epidemiologist. Dr. Gordon is a pediatrician. So at times we think about individual risk, but we have to think about community risk at the same time. And that's the challenge. We have to consider, what are the rates in our community? Are they low? And therefore, some activities will be safer because of that community risk being low. And at other times, the same activity, the same exact question would be answered in a different way. And so it's difficult. And I wanted to start with that, just to preface with today's conversation, there will be a lot of it depends. And it will depend a lot on your family situation. It will depend a lot on who you live with, who's at risk, what are the other criteria. So I hope you'll be patient with us today, but I completely agree with that assessment that if you can dine outdoors or pick up food and take it home, that is by far a safer option. That is what I am doing with my 3 kids under 12.
Dr. Sabharwal, is there anything you wanted to add on that?
No, I completely agree with both Dr. Gordon as well as Dr. Linos. In terms of you're picking the risk, the risk is there. It could be small, but it's not zero. I tell families that, eating outdoor, the risk would be the least, as opposed to eating outdoors, the risk would be much lower as compared to if you're eating indoors. And right now, the community transmission rates are very low. So if you want to be safely seated, keeping the social distancing and the mask while, you enter the restaurant, if you have to enter the restaurant for a brief period of time, that should be okay. But like Dr. Linos said, either sitting outside or takeouts or sitting in areas where there is improved ventilation or the windows are open could be another chance where the families can opt to sit with unvaccinated kids.
Great. And could I ask about camp specifically? A number of questions came in about camp, such as should children wear masks on camp buses? Maybe address that, and just more broadly for parents who are sending their children to either day camp or sleepaway camp, what they should look for in terms of safety protocols, or what kind of risks they should be keeping in mind.
Sure, I can start in and then others can join. So the CDC, I think, came out with guidelines on summer camps, both sleepaway and day camps, end of May, just a couple of weeks ago. And what they recommended was, of course, if the staff and students more than 12 years of age, if they're fully vaccinated, then they don't need to wear any mask. But here we are talking about the situation where we have children less than 12 years of age with staff, which probably is vaccinated, but the children are not. So if the children are engaged in outdoor activities, they're spending a lot of time outdoors and they can socially distance there, it's probably okay that you don't need a mask outdoors. But the situation changes when you are indoors. When you are indoors, it's recommended for unvaccinated children to continue to wearing masks, which would be a cloth mask, which is double layered, breathable mask, when they're spending time indoors. And also the other thing what CDC recommended is that more applies to camps where there's larger cohorts of kids. So maybe you want to split those cohorts, right? So you have a younger cohort, 5 to 6 years of age, then a 6 to 8 year. So you're not mixing those cohorts together when they are indoors, trying to keep them separate, trying to, same things what we did in school, physical distancing and masking, and the other thing we have to be careful, I think, with the camps is, which was a big deal when we were dealing with the public schools, was eating, when the kids were eating or having snacks, or so right now the weather is nice, with the summer we can recommend that if they have to eat or they have to either their snack or lunches, the ideal situation should be that they should be outdoors. But if there are no choices, say it's pouring heavily and they have to be indoors, so it's better to be in a room which is like an auditorium or a big cafeteria, which is well ventilated, and you want to keep the distance at least 6 feet amongst kids who are unvaccinated and they're not wearing the mask while they're having their snacks, drinks, or lunches. And the other thing would be that the staff, even though indoors, they're still recommended to wear a mask unless it's a situation where where you do testing, which certain camps, I think that more applies for indoor camps or overnight camps, where they have these cohorts where they get them tested when they come in, the staff as well as students, they part together for 3-4 days, they again get tested, and then at that situation, at that point, they feel comfortable maybe not wearing masks at all times.
I totally agree with everything that Dr. Sabharwal said. And I was going to say, I think that on the bus, the kids should wear masks, which is what Dr. Sabharwal is saying too, I'm sure. And especially because I think that in most day camps, the kids are not cohorted on the bus. So, you're sitting with like the kids from like the 6-year-old group, and then some kids from the 4-year-old group. So have your kids wear masks, and I think that they try to social distance on buses too. So I think that was just echoing what Dr. Sabharwal was saying.
And I just want to add, a sort of unrelated to COVID, I expect a lot of camps will be having the kids outdoors a lot more. So just remember sunscreen, extra water, the things that we sort of forget are, the increased risk now for the kids are getting sunburned and, being in the sun a lot, wear a hat, wear, long sleeves. So that's the type of, as parents, we have to reduce our COVID risk, but also protect the kids from the other, bug spray if they're going to be out in the forest. So just don't forget about those. And chances are they'll be spending more time outside. So don't forget a hat.
And then one additional thing I just wanted to add as well, just screening, if you feel your child is sick, don't send the child to the daycare, call the pediatrician, maybe the child needs to be tested. So I think it's very important because they're going to be amongst other kids who are unvaccinated.
Great. Thank you. That's very helpful. On the topic of masking, some folks are asking about whether parents who are vaccinated should be themselves continuing to wear masks, either to model masking for their kids, to get young kids to comply with it, and or even when the kids are not around, whether they should be wearing masks to protect the kids, to make it less likely that they bring something home to the kids. So I wondered if any of you could comment on those issues of in which situations vaccinated parents should consider continuing to wear masks.
I can jump in with that. So, we know that if you're vaccinated, your chances of getting it and passing it on are pretty low. We didn't know that 6 months ago, but now we know that. So therefore, that risk of you as a vaccinated parent getting your kid sick, it could happen. There are breakthrough cases, but it's rare. But I do think that the modeling piece is important. And I do think that, it's not difficult to continue wearing a mask when you're, say, grocery shopping or where you are in a crowded indoor place. So again, it will depend on your situation. In our family, if we're doing something as a family in an outdoor place, like I did take my 9-year-old to the MFA. And, I thought about it and I decided that would be a nice thing. We both wore masks. About half the people there were wearing masks, half weren't. We went to a floor that was not so crowded. We sort of left the ones that were crowded. But, I was wearing it vaccinated just because, I wanted to model, but I felt safer doing that. So I think in many ways, parents, it's easier to make family decisions and to say, we as a family wear masks because kids will start asking. And I think here it goes into the mental health piece too, children asking like, why? And why are you vaccinated? I mean, my children are doing that already. Like, why don't I have access to this vaccine? And that's unfair, and that language. And so reducing some of that real inequity, there is a real inequity right now. Some kids have access to it and some don't. By having similar behaviors as a family, I think that makes sense. And, as parents, you can also talk to your friends, your kids' close friends, and see if you can pick up some rules that you have as a cohort, because I do think norms are really important here. Beyond what is actually safer, norms are really important.
Dr. Gordon, do you want to add anything to that?
I thought that was really eloquent. So I am probably not going to say anything too spectacular, but I think in some ways when we wear masks, we're telegraphing to everybody around us that we think masking is important. So when like I'm in the Trader Joe's or I went to REI and there's a sign that says you don't need to wear a mask, I still wear the mask because I feel like it's like covering my nose when I sneeze or something. Like I want to be socially appropriate with other people and let them know that our communal safety is important to me. I think a lot of kids are already, they understand the norm of wearing masks. So I don't know that, I would say, I'm not sure that we need to wear masks just to like model or show our kids as important. Many kids, for them, 14 months or however long it's been, 16 months is like a longer time period than it is for us because they're much younger. I mean, there's some kids who they can't even remember what it was like, not to wear a mask. They're 3 years old and they've always worn a mask or they've always seen people wearing a mask. But I think that for me, it's a way of showing and communicating without saying anything that community health is important to me, and I'm going to do whatever I can, even though I'm vaccinated and the risk that I'm going to spread this is really low. I still wear masks. I think it's a good idea for all of us, especially in sort of congested areas indoors.
Thank you. Dr. Sabharwal, did you want to add to that?
I echo completely what both of them said. The only point I would like to make here is for kids whose immune system is severely immunocompromised. So that would be a child where the parents want to wear a mask, when they're going outside grocery shopping, or even they're fully vaccinated. So you want to protect that child, unvaccinated child with chronic medical conditions or other severe underlying immunocompromised situation, because that's somebody that you don't want them to acquire or get COVID.
Thank you. As we've been chatting, a few questions have come into the chat that are very aquatically oriented. So there's a question about whether indoor pools are safe or other indoor public recreation facilities. And there's a question about, is it safe to take the family to an indoor water park if some of the children are too young to be vaccinated?
I can start with that and others can chime in. What I can tell you, what CDC, these guidelines came out about physical activities about last year. So there were certain sports where mask was not encouraged, and swimming was one of them that, the masks are going to get wet. So you can't really be, swimming with a mask on, or even when you are, what I could say, if it's an indoor pool and you're worried about the ventilation, maybe have the mask on when the child is not in the pool. You can continue to wear mask, but swimming with the mask on is not recommended. So So definitely you can't wear a mask in those situations. And then again, it depends upon the situation, how big the pool is. I know certain pools before they were they had appointments. So for 1 hour, whatever time you booked, they just allowed X number of families, trying to keep the distance amongst the families. But now with the situation has changed where these pools are going to be open, and so you want to make sure, I would say that, keep the mask on till the child enters the pool. And I don't know if Dr. Linos would like to add something else.
I mean, for me, it is one of those, situation where it's a higher risk activity. It's indoors, people aren't wearing masks, and also indoor pools might bring a lot of tourists. So the fact that we have low community risk in Brookline, you can't be guaranteed that is the case there, because there's people coming from places where there might be higher community risk. So for me, that is a place, even for the MFA, I did consider that. I said, the MFA, maybe half the people here are from Massachusetts and half aren't, so places where you're entering, where you think there would be people from other states where they have lower vaccination rates or lower, higher rates of COVID, you should double think. And then if masks are not possible, if you can't wear a mask because of the activity, whether it's eating or swimming, I would say that is a higher risk. And for my family, even though it sounds really nice, I would not do it this summer.
I just want to chime in and say, I think though, I agree, it's not a super safe activity. An outdoor pool would be much better. But I think that like that moist, that humid environment, it's actually probably not super ideal for letting these little particles like stay suspended in the air. So you probably could catch it if someone is near you and like shrieking in joy as they're in a pool, but it's a little bit less of a friendly environment for a respiratory infection to like stay afloat in the air because of the humidity. So, but still, outdoor pool is much, much, much safer.
Let me transition a bit to asking some questions about what is safe to do with specific family members. And so a number of the ones that have come up are around grandparents. So first, in general, with children unvaccinated, what is safe to do with grandparents who are vaccinated? Is it okay to be inside with them unmasked? Is it, and to what extent is it okay to kind of drop precautions with grandparents? And then there's a specific question in a case where the grandmother has a allergic reaction that makes it impossible for her to be vaccinated. So the parents are vaccinated and the grandfather is vaccinated, but the grandmother is not. So in that situation, can the children be inside with her? Should they be masked? Is it okay to have sleepovers? Kind of what are the constraints, I guess, on grandparent interactions? And is that different if both the children and one of the grandparents are unvaccinated?
I read that question earlier and I thought there's some unknowns. I think this is like Dr. Linos was saying earlier, it really depends on your appetite for risk. It's certainly more risky. If this family is not living in Massachusetts, if the grandparent family is living in a state with higher cases right now of COVID, I think that's important. There is more risk if you have an unvaccinated adult because transmission happens more among adults, than children haven't been like the #1 transmitters. So I would say masking would be ideal or do this activity outdoors. Those are some thoughts that I have on this one.
I'm happy to jump in a little bit. I think something we haven't said clearly is that children are less likely to have, severe COVID complications. We know that. It's not that it doesn't happen. And there have been some tragic complications. And what we don't know enough about is the long-term, what is happening with, you have a mild COVID case, but then you have some long-term consequences. So it's not to say that we should trivialize it, but the chances of a child having a severe complication, being hospitalized, dying is very rare. But for a grandparent who is unvaccinated, actually the children could also transmit in that direction. So you need to think about the risk for both sets. And as it's the same family, it's the grandparent, it's the child. You obviously need to worry more about protecting the elderly from from getting COVID, because we know that they're, and we even know that vaccinated elderly, and maybe actually Dr. Sabharwal, you can speak to that about how, how the vaccine may not work as well for the very old because they're very old. I don't know, I'm not an infectious disease expert. So, but what does it mean, and how can we protect both the older who are vaccinated in our families and the youngest ones?
Yeah, I agree with you completely, because in addition to the children, here is the unvaccinated grandparent is more at risk, or to develop complications or acquire COVID, because the kids could be either asymptomatic, or have mild disease and might not know. So in a situation like this, we would recommend, meeting outdoors as much as possible, and if you can maintain more than 6 feet distance, maybe you can let the mask go. But in an ideal situation, we would recommend wearing masks for both the unvaccinated grandparent as well as the child, and spend time. It was the same thing like what we were doing last year in fall, when summer into fall, when our cases were dropping, that people wanted to meet their families and the grandparents, and they were trying to meet them outdoors as much as possible. And then again, it's not, there is no right answer. It's again, there is a risk, which again will go back to, depending upon what others were alluding to, which state, which county they are, the grandparents are. They could be from a place where the prevalence of COVID could be much higher, or vice versa.
So in addition to concerns about the elderly, folks also have concerns about the other end of the age spectrum, about infants, who probably have the longest to wait for a vaccine. And so there's just been a general question about, for everything we've been saying about what's safe to do, where it's safe to take your kids, is that the same or different when you're talking about a child under 1 year old? So that's maybe I'll start with that. It's kind of the first question is, would anything that you've said be different for an infant as compared to a preschool or school age kid?
I'll jump in a little bit, so there's infant and then there's infant, neonate. You're not at 12 months or 11 months and, 35 days or something, your immune system is a little bit more robust, but an infant under 4 months is still fairly immune suppressed. An infant under 2 months, quite immune suppressed. However, there have not really been that many cases of infants with severe COVID. So I would say these are immune suppressed people, the infants, and especially the very young infants, but they haven't been as severely affected. And I think that's partly because of the way infants breathe. They're not breathing in as deeply. So I think I would still be cautious. I wouldn't take an infant into a restaurant or a crowded place. Of course, infants cannot wear masks, but I don't think it changes the calculus too much. The other people who are not vaccinated should still be wearing masks around the babies, and toddlers under age 2 who can't wear masks themselves.
Okay, Dr. Linos or Dr. Sabharwal, do you want to add to that?
Yeah, I agree completely with what Dr. Gordon just said, that most of the infections in a healthy infant, less than 12 months, they'll be fine. They might have just mild runny nose or congestion. What we have seen is mild illness. Unless, their immune system is compromised, they were a premature baby, they were in the NICU for a long period, they have other conditions like chronic lung disease, or they're taking some kind of medication, or where their immune system is suppressed. So those infants I would be very careful about. So what we know from, our experience from past year from in United States as well as other countries, the infants who got into trouble were the infants who developed severe disease or had to be in the ICU for prolonged periods, were the infants who had some kind of underlying chronic medical condition. So it's very important that they discuss with their pediatrician, and be extra cautious taking care of that infant, that you would want to protect that infant as much as possible.
Okay, we also have a question from a parent who's planning to send their 4-year-old and 7-year-old back to in-person school in September, but is worried about a 5-month-old they have at home. And so is concerned about the risk of older children potentially bringing COVID home to a baby who's at home. Can you speak to the likelihood of that, or to if any precautions should be taken around that?
I mean, I think that probably the 4-year-old and the 7-year-old are still, unless things change dramatically for us, going to be following the same kind of guidance where indoor activities should be masked. And to that extent, I don't think that the risk for the 4-year-old and the 7-year-old is that great, and then it will be fairly unlikely that they'll bring it home to this 5-month-old. But as Dr. Sabharwal was saying, really, infants and young children without underlying medical conditions have done very well with COVID. We don't want them to get COVID, but it hasn't been the crisis that it has been with, older people, with elderly people, or people over 50. So I think the risk to the baby is very low, because I think that the 4-year-old and the 7-year-old are still going to be masked indoors unless things really change dramatically. That is what I foresee.
Yeah, I completely agree. And you want to look at the risk, and the benefit of sending the 4-year and a 7-year-old to school is much more than keeping them home to protect the low likelihood of an infant getting COVID from the, because the 4 and 7-year-old can get COVID from other places too. So we want to emphasize that point. It's just, when we had cases in schools, most of the cases were from the community. They were not happening in schools. School are safe places, in terms of the guidelines, and they took in terms of ventilation, social distancing, masking, hand washing. The rates of transmission of COVID within school was quite low. And then the other point I want to emphasize, the risk of acquisition from an adult to household children is much higher than a child bringing COVID and giving to other kids, which has been shown already.
So that in some ways, oh, sorry, go ahead, Dr. Linos.
No, I was just going to add that it's been a really difficult year, and I think as parents we are doing all these trade-offs in our heads, trying to figure out what is the best thing. And something like sending your kids to school, you really don't have a choice. I mean, you could change your entire, if you were homeschooling, obviously you could homeschool if that's something you were doing anyways. But I feel like a lot of parents feel a lot of guilt and a lot of anxiety. But I think this is one of these cases where, you make the rest of your life, reduce risk everywhere. But school is something that is so important, both for kids that, I agree sort of with what Dr. Sabharwal said. They benefit so much from going to school. Schools have been doing well. Hopefully some, here in Brookline public schools, there were the pooled, testing programs. They were getting very, very few, if any, positive tests. So as long as our rates stay pretty low, of course, things can change. If there's another wave, if there's something going in the community, or if everybody's away for a break and you want to keep your kids home for 4 or 5 days to see what happens, like you can make some short-term decisions depending on what's happening. But right now with our current rates, I'd say that 5-month-old is okay.
Great, thank you. So you mentioned homeschooling, and there actually is a question about homeschooling. There's a parent asking, what if you want to keep your child who's under 12 home for homeschooling until they can be vaccinated? So I think there's just some apprehension among some parents about going back fully in person in the fall. And just for speaking for Brookline, particularly there are a number of kids who have been fully remote this year, and that won't be an option in Brookline schools in the fall. So I'm sure that that's part of what's going into people's thinking, trying to think about navigating that shift in what the public school options are. So I don't know if any of you have thoughts on parents trying to make that decision about whether to homeschool up until their kids can be vaccinated.
I will say that I think if there are concerns about a family member who's really vulnerable, somebody who is immune suppressed, or if the child, him or herself, is immune suppressed, I think, maybe you go towards the side of homeschooling. But there's such a benefit for children developmentally in being with other kids that I don't think that the risk of COVID at this point for otherwise healthy kids in families where the adults are healthy, I don't think the risk of getting COVID is big enough to keep them home. I think the risks of sort of social isolation are bigger. So, but if there is someone in the house that's immune suppressed, I think everybody needs to make this decision for their own family.
And I was just going to ask Dr. Sabharwal if she has a sense. I know you're doing, I know we haven't gotten to the questions about vaccines, but I think there is a chance that children under 12 will be vaccinated within this next school year. Is that your understanding too, Dr. Sabharwal?
Yes. So they started the trials last week, at least Pfizer, they started the trials for the age groups 5 to 11 years of age. And they're hoping to get the data by September and then submit it to FDA for EUA, what we call emergency use authorization. So they're hoping that sometime in the fall, we should have the vaccine, not for the preschoolers, but the 5 to 11-year-olds sometime this fall. I mean, that's the hope right now. Things change and evolve very quickly. So don't quote me on it. It might get delayed, but that's what the company is hoping for.
Okay, let's switch gears a bit. And folks, if you think of other questions in the talk about what is safe to do with whom or where, or masking questions, feel free to continue to put those into the chat. But I want to shift to another topic that we've gotten a lot of questions about, which is travel and making decisions about travel over the summer. So we have several folks asking, how safe is it to fly with unvaccinated, how safe is air travel with unvaccinated children? When the parents are fully vaccinated, but the children are not, obviously, and including children as young as 1 year old. Several families are asking about decision-making about air travel.
So I can start and then others can chime in. What we know from last year is that there were few cases where there was transmission of COVID in the planes. Especially, if you're sitting 3 feet in front or 3 feet, behind, and you're unmasked for short periods of time. And also with the new variants that are emerging, which are more transmissible, there is definitely a concern that you can acquire COVID on a flight. But then again, it depends upon the situation, how long the flight is. Is it a domestic flight? Is it an international flight? Shorter flights, we know that if you're masked during, a 2, 3, 4-hour flight, if you're masked, wearing a proper mask, the risk of transmission, and if, say, the flight is taking off from Boston, where we know the adult vaccination rate is closer to about 70% of adults already have at least one vaccine that we know of, that a little bit of the herd immunity kicking in, that the local transmission is low, the risk of acquisition is low. But then again, if it's a prolonged flight, or it's an international flight, or you're traveling to another area, where the community transmission is much high. Since that for international flights, at least my understanding is that you require a negative COVID test before travel. So, so at least that everybody on that flight, has a negative test, prior to travel. So I would never say that the risk is, there is a risk. How much is the risk? Again, depends upon the community prevalence, and if you're unlucky that you ended up sitting somebody next to somebody with COVID, that you can acquire the disease. But again, this is a decision that the families have to take it together, and we know that certain families are traveling domestically. Of course, they want to visit the grandparents over the summer break, and going back to the same point, that the worst case scenario, even if the child does get it, most of the kids are going to have either mild infection and get better very quickly, if they end up getting COVID. The other thing I would throw in there, that just to be extra cautious, if you can get a better mask, if you just want to be careful, it's a long flight. And I know it's hard to wear these other KN95s and other kind of masks, which offer more than 95% protection. Could be a good idea, or you can choose to double mask your kid with two cloth masks, or a cloth mask with a regular disposable surgical mask is another option to add that additional layer of protection.
Great. Dr. Linos or Dr. Gordon, do you want to weigh in about air travel decisions at all?
I wanted to say I agree with Dr. Sabharwal, and I think that air travel is a little bit riskier. Like eating in restaurants is a little risky, but air travel is like a little higher level of risk because you have the plane and you have all those unknowns on the plane. And it is true that people in most international flights need to get a swab 3 days before that's negative. But we know that, you could in that 72 hours since your swab would become positive, or, but in any event, I think that the international travel is much riskier. Airports are crowded. So I think that everybody needs to make their own decision about the level of risk that they're comfortable with, but I think that international travel is still really risky. Maybe domestic travel, especially shorter trips, and I agree with Dr. Sabharwal using those higher filtration, the KN95 masks. We used to call them like the tuberculosis masks in the hospital that are hard to breathe through, but they actually are protecting you significantly better. So you could wear that during the mask if you have a short flight.
And I'm just going to add, just a personal story, just so you know that we're dealing with the same sort of debates in our own lives. My parents live in Greece, and the kids haven't seen them in almost 2 years. They can't come here, even though they're vaccinated, because the US has a ban on people from Europe coming. And that would be my first choice. They're both healthcare workers. They come, they see the kids. So I am at the moment trying to make that decision. Do we go to Greece to see the grandparents or not? And the things that I'm weighing are the travel itself. It's over, 15 hours. Therefore, the kids will have to eat, have to take off their masks. If I were to do it, I would do an overnight flight to enable them to sleep most of the time. The things I would think about, include that. But it's difficult, and it's difficult thinking, as we said, that there might be a vaccine available to the kids, although 2 of mine are 3, so they won't be over 5 by September. So can I delay it until Christmas time? And for my parents who are in good health, the answer is probably yes. But my in-laws live in Michigan, and they're actually in very poor health. And so we did take the kids to Michigan to see the in-laws. And that was the debate. It was kind of the risk of them not seeing their grandparents because they're in bad health and, something could happen, versus not seeing my parents for 2 years, but chances are they'll be okay to see them in a year. And so I just want to share that it's, it is affecting everyone. Healthcare professionals, public health people are having the same debates, and we will have to make a decision based on different calculuses. And so I share that to say that whatever decision you take, it's not, make the decision and then make a plan of how you can reduce risk based on that decision. The overnight flight, how do you feed your kids before you get on a plane? Where are you seated? If you can afford business class, we can't, things like that are things. So there's the decision. And then once you've made a decision, there is what we call risk reduction, and both are important.
So
sorry, I was going to say, sorry, can I jump in? I was going to say direct flights, I think are also safer if you can find a direct flights, because then you're not dealing with, a second airport and bringing people from all different places onto that second airplane. So if it's possible.
So it sounds like what you all are saying for air travel is, if you're going to do it, overnight flights, higher quality masks, and direct flights are all ways to mitigate risk, but that it is a higher risk activity than pretty much any of the other things we've been talking about. There's Dr. Linos, there's a parent in the chat who's wrestling with a similar decision to the parents who are vaccinated, are planning to go to the UK to visit grandparents who also are vaccinated. And they're debating whether to bring their 10-year-old with them. And they're wondering if you advise against it. So we'll see if anyone wants to weigh in on that dilemma, or if it's really something that has to be a personal decision.
I mean, it certainly has to be a personal decision, or a decision with your pediatrician. And we're lucky to have two pediatricians on the call with us today, but, they would have to make the decision. If I'm reading the question, the grandparents are healthy. Okay, so, a question would be, can the 10-year-old wait and go at Christmas time? Is there another period? If they're within 6 months, we do expect that there will be a vaccine for 10-year-olds. At least that's what my expectation is. So what, if maybe the one parent, I'm making assumptions here, that, one parent whose parents it is could go visit if that's important. But I'm making the same decision right now. I haven't made the decision yet, so I'll stop. But Dr. Gordon or Dr. Sabharwal, you're pediatricians.
Well, as a pediatrician, I think I would say the same thing, that it's up to you. If this child is a healthy child with no asthma, with no underlying conditions, the underlying conditions are, even obesity is an underlying condition. The kids who get COVID fare worse, but most kids with COVID do really well. On the other hand, that Delta variant is now quite prevalent in the UK. So I don't know. I think that this is a personal risk decision that this family has to make. I cannot tell you how I would go on this one, but I think I would think long and hard and maybe try to wait if I could wait. If not, if you have to go, I would try to make it as safe as possible, outdoor activities and that kind of thing.
So there's also a question about staying in hotels while traveling. Is it safe to stay in hotels with unvaccinated children? And are there any steps to try to mitigate risk in those scenarios?
Hotels are safe. It's just the other people are not safe. So the hotel is not intrinsically unsafe. I think that if you're in a public area in the hotel, like if there's a crowded breakfast bar or something like that, then wear a mask. But I think that we've pretty much, the healthcare community or the scientific community has kind of come down on the side of it's probably not fomites on the surface. You're not catching it so much from the doorknobs. So, it's okay to go stay in a hotel with your family. But when you're in those public spaces, just mask up.
Okay, we have quite a specific question about, and I'm sure there are so many people right now wrestling with really specific scenarios about families trying to get together and trying to navigate what precautions to take and how to do that. So this is a question about family or friends that are visiting from out of state and traveling here by car. They're wondering, are there any more quarantining recommendations? So this is family members that are traveling to Massachusetts. Is it okay to have kids in the same households, like grandchildren that are from different families, wear masks? Can they be in the same household? And if they are, should they wear masks or be cautious inside for a week or two? So the adults are all vaccinated, but they've got children from multiple families that are unvaccinated because of their age. And they're trying to figure out, is there quarantining needed, or is there, do they need to wear masks inside? Can they stay in the same house? How should they navigate this? And I'm sure there are many families on this call that are facing those kind of decisions.
I'm going to jump in and say we haven't talked about testing. We've talked about testing in terms of people getting on international flights, but in this scenario, I would get everybody tested a couple days before traveling, or, with a PCR, but now we're getting results pretty quickly. And if you're driving and, while on the drive, you're not going in and being exposed, I would say, everybody has a negative test, meaning test the kids. You could test the adults, but I don't think that's necessary. And then go spend time together. Don't need to wear masks if it's 2 or 3 families. And then it's more, what are you doing on vacation altogether? Don't go into restaurants altogether. I think if you're sharing a household with the cousins, we don't, there's a joke that, public health professionals want to take away joy. We need to make sure that we're allowing people to come together. We've done really well. If all the adults are vaccinated, the kids are tested, it's nice. You should have a summer and enjoy it. And it's hard to keep kids wearing masks if they're sharing the same house. They have to eat meals. So I would use testing here as my kind of additional step.
think you're muted, Dr. Gordon.
I'm sorry. Okay. I don't want to take away joy either, but I want to say, like, it depends. It depends. If these people are coming from a state where there's still a lot of COVID, even if they get a negative test, I think I would feel uneasy. On the other hand, if they're coming from one of our neighboring states or another state that has fairly low rates of COVID right now, and if you think their level of caution is similar to your level of caution and they haven't been going to, like, really crowded events, some like indoor concerts or something like this, I think it's probably okay. It's not zero, risk is not zero. You have to decide if your kid is immune suppressed. I think it's a different decision, but I think I go with, Dr. Natalia Linos on this one, that it's probably okay.
How about in the reverse direction? So when we're in Massachusetts, we're in a state that has lower rates of COVID right now and higher rates of vaccination. And so there are also parents asking about planning to travel to visit family and friends in other states. I'm sure that the level of COVID in that state plays a role, but how do you make decisions about what's safe to do when you're going to visit someone in another community?
I think it goes back to what we have been doing when our rates were higher here, right? So avoiding higher risk activities, avoiding, indoor restaurants or indoor places which are overcrowded with poor ventilation, right? Trying to spend as much time outdoors as much as possible, for kids who are unvaccinated, putting on the mask, if they have to be indoor for limited periods of time, limiting that time, and then, even same situation when you're traveling by bus, train, or public transport. I think the rule is still that you have to wear masks, while you're being transported, using public transportation or any other kind of transportation by land or air. That it's recommended that you follow those guidelines, and then each state could, depending upon their Department of Public Health, might require. But my understanding is that has been waived, where you don't really need testing, unless there's and the other thing is avoid travel. If a county or a state that you're visiting just had a recent outbreak, or there's a concern for variants, is it someplace that you can delay your travel? Can you wait?
So there are a couple of questions about decision making when you're not traveling. A couple new questions have come in, and I think Dr. Linos, your suggestion about testing as a way to try to mitigate those times when families are merging for a rare occasion is really helpful, but families are wondering how to navigate these kind of contacts when presumably you're not going to get tested every time you have somebody over, right? And so there's a question about cousins, baby cousins playing with older cousins who are unvaccinated. Should they be indoors or outdoors? Should they stay masked? Folks want to comment on how to navigate kids from different families playing together, including babies, when they're unvaccinated.
If possible, outdoors or well-ventilated spaces are a good idea. We're lucky because there isn't that much transmission right now in Massachusetts, but it's not a zero risk if everybody's hanging out indoors. So I would say ideally you're doing it in the backyard or in some very well ventilated spot.
There's another question where the parent has 16-month-old twins, and they've been having over to their home adults who are vaccinated, and they've been asking those adults to wear masks when they're close to the babies, and they're wondering, is that silly or is that a reasonable choice for risk reduction for the infants?
Sorry, Dr. Gordon, do you want to jump in? You're the pediatrician. I was going to jump in as a twin mom myself. I first want to say, 16-month-old, that means that most of the pandemic, you've had twins at home, you have survived. And that is, big congratulations to you. I remember my twins are almost 4, but those were hard months. So that's just a side note. But I would say, adults, your friends who are vaccinated, asking them to wear a mask is not a huge ask. So what is your own personal comfort? But I would put the kids to bed and then unmask and have a dinner with my friends. It's not, if they're going to be holding the twins and you want them to wear a mask, it is probably overcautious, but I don't think that's a problem. I don't, but don't. And I share this as a twin parent myself. Like, it is so hard for twin parents to socialize, so that if you have friends over and you want to have a meal, you should be able to have a meal, put the kids a little bit further away in another room and take off masks and enjoy it, just because the mental health piece, speaking as a twin mom myself. Sorry, Dr. Gordon.
No, I think that was very well put, because really the human element of this is being forgotten. Like, people need to socialize and they're not. 16-month-olds, though, they have a good immune system. They, I hope, are very healthy. So if they don't have an underlying condition that puts them at some high risk of COVID, I think it's okay. I think it's okay to have your friends over. I think if they're like singing to the kid, they can wear a mask. But if they're just sitting at the table eating, turn on a fan, have some good ventilation, open a window. It's okay. It's okay.
Okay, we have yet another babies and masking question. There's so many dilemmas that folks are trying to navigate. So this one is the family has a child under 2 who refuses to wear a mask, or it's not expected anyway for kids under 2. And they have a lot of outdoor gatherings with other children who are unvaccinated. And so the parent is wondering, should they be keeping the child 3 feet away from other children? Does it make a difference whether the other children are masked? Kind of how to navigate that situation of outdoor gatherings with unvaccinated kids from multiple families.
For outdoor gatherings, what CDC has done and what we know from studies, that the risk of getting COVID is very, very low. It's like 25 to 30-fold low, lower, and especially, unless you're in a very crowded setting, elbow to elbow, right? If the kids are in a yard and they're playing, they are unvaccinated, they don't have their mask on, it's okay for the young child to be there, because you don't want to deprive, in this nice weather, you don't want to keep them inside, for that very, very low risk. So I would say spending time outdoor is okay for that child to be with other, as long as it's not a very big group. And, if you want to be careful, you can say that, especially for preschoolers, and it's sometimes hard to follow the respiratory etiquette, covering their coughs or sneezes, right? So you can discourage another child who's coming who might, be a little bit, sick, or, that goes back to, if you have a cold, stay home till you are better. You don't want to take a chance. But if the other kids are otherwise healthy, no other chronic medical problems, and this infant also, or the 2-year-old, it should be okay, that they could be outdoors playing with other kids.
Great. So I want to transition. There are some questions about variants, and then also questions about health effects on kids, and particularly kids who have underlying conditions. So I want to shift to make sure those are really important questions, that we get those in, because I think we probably could go on forever with different scenarios. Feel free to still add them to the chat if you have others, but there's so many possible permutations of scenarios that folks are trying to work out. So one question is asking if you can compare what the risks are for unvaccinated children today versus a year ago. It's kind of an interesting question. So the writer mentions that there are more contagious and dangerous variants circulating, which is certainly true, but a lot of other things have also changed in the past year. So they're asking for your take on the level of risk for unvaccinated kids today versus last summer.
I mean, if it's a lower risk today in Massachusetts, it's a lower risk today in Massachusetts, but it's not a lower risk, worldwide because of the variants. But right here, I think we're in a lucky situation right now. So significantly lower risk, and we understand better how to protect ourselves than, say, at the beginning of the virus. So masking if you're indoors, and social distancing if possible outdoors.
Dr. Sabharwal, what's your take?
No, I agree with Dr. Gordon as well, that we know so much more about the disease, and we we've followed the risk mitigation strategies that we have been doing, whether it be masking, physical distancing, that all those things have actually worked. And we have shown that in the schools, for the schools that have been open during a time when there was a little bit of community. Right now, the community transmission is very, very low. I think Brookline is 0.06, the whole state of Massachusetts is less than 1%. Plus, we have the adults who are vaccinated, right? So I would say that even in spite of the transmissible strains, we haven't seen a surge in the number of kids getting unvaccinated kids getting the infections. I'm seeing other things in the hospital. The other respiratory viruses are back. RSV is back. Which is respiratory syncytial virus. Our trainees didn't see that for a year. Like, what is this? You're like, okay, so the other respiratory viral infections are coming back, and so we are still not seeing that much COVID, in spite of the kids being unvaccinated and all the regulations, rules and regulations being lax, by our governor, which happened over the Memorial Day weekend, and most of the places are open. So we, not that it might change, because we are still learning more about the variants. It could be that the variants could increase in number, and we might see some transmission happening. But what we know so far is like the vaccine seems to be working even against the variants. Maybe it's a little bit less efficacy, but it's not that that being vaccinated you're completely unprotected against the variants.
Dr. Linos, do you concur, or do you have other thoughts?
I completely agree. The one thing we haven't said explicitly, and I think for everybody in the audience today, chances are you're vaccinated if you're here listening, on a Sunday night, but not everybody in our community is, even in Brookline, our rates aren't there. So, the best thing you can do to protect your kids is making sure that every adult that they are around is vaccinated, encouraging a caregiver. If you have a babysitter, making sure that they are vaccinated. These are things that we haven't said explicitly because sort of in the back of our heads, we're assuming, but I think it's important to say so. And you have the right to ask whether you're sending your kid to camp, whether, and to encourage people. And it's not about shaming individuals and, connecting them to people for more resources. We do need to get every adult who can vaccinated and every child over 12. So, that is the best way to protect our kids at this moment.
Quick piggyback question on that. Somebody just asked in the chat, if you have a babysitter who's vaccinated, is it okay for your child to be indoors unmasked with that person, or should they still be masked around them?
I think that the babysitter counts as household member. So that is how we've been kind of treating babysitters for the past year, acting as though it's a household member in a way, and hoping, you have to have a frank conversation with your babysitter about the kind of risky things the babysitter's doing when they're not with you. If they're going out to crowded places, maybe, or they're taking international trips, you might have different feelings, but I think that your child can be unmasked indoors with a vaccinated adult that they're seeing all the time.
Okay, I want to make sure that we include this next question because I think it's an important one. The situation, as we've been talking about, has evolved a lot over the past year and is likely to continue to evolve in the months ahead before we are able to get our kids vaccinated. And so there's a parent who's concerned about variants and is asking, what are the best sources of information that will keep getting updated about variants and about guidelines for what to do with your unvaccinated children? Where should parents go to continue to monitor the situation in the months ahead? Do you all have any recommendations for them on that?
I know for us, American Academy of Pediatrics, comes out with guidelines, and then they updated, going back to school guidelines, summer safety, summer camps. The same thing with CDC keeps it, comes out with these guidelines, looking at what's happening in the community, what is the data around, when they decided that, they were no longer seeing cases or increased transmission when more and more adults were vaccinated. The decision was made, okay, based on all the scientific data that we don't, vaccinated adults don't need to wear masks anymore. So this situation is going to evolve over the next few weeks to months, and we will have more information about the variants. And then, the public health authorities at that point can make those informed decisions based on the scientific data that's going to emerge, whether it be, right now we are doing, say, asymptomatic screening of children and staff members in schools. Do we need to continue that in fall? That will again depend upon the numbers, how much variants are there in the community. And what I can tell you is both at national level as well as the state level, they do keep testing the strains, to see what is the prevalence, how much is what Dr. Gordon was saying, is the Delta variant increasing, which is the strain which is more transmissible that they are now seeing in UK. And there's a concern that the kids over there are acquiring that SARS-CoV-2 infection with that variant. So that's something that we are monitoring, and these things are going to continue to evolve. And the vaccine is not far. We are hoping that by fall we should have the vaccine, and we will go ahead and vaccinate all the eligible kids.
Dr. Linos or Dr. Gordon, do you have other suggestions besides the American Academy of Pediatrics? Other suggestions for where parents should look for updated info?
Well, of course, I love the American Academy of Pediatrics website, just as Dr. Sabharwal does, because it's our organization, and I think they do an awesome job. The Mayo Clinic, you can just Google Mayo Clinic. They have a very readable website that's very user-friendly. So, and I think they're very, it's very high quality. And then, of course, CDC. That's where I send people. But yeah, Mayo Clinic, it's out there in Minnesota, but I think they're doing a nice job giving very easy to read and easy to understand information.
And I was going to add that, a lot of public health, experts are now much more on your every, Ashish, people are on Twitter, and, you could follow some well-respected epidemiologists on social media too. They're very active, so news reports can at times be a bit misleading, but I think, as long as they're reputable and they're quoting, well-known epidemiologists, I would trust them. But I should say that, also it's not up, you don't have to do, if you're not yourself an epidemiologist or a scientist, you can wait until the CDC gives recommendations. You can talk to your pediatrician. You don't have to become an independent expert. That's unfair on you and on others. And I would also add that we're learning a lot from other countries. Singapore, for example, the Delta variant, we are as an international community. So the WHO also has information. It might not be easy for you to translate that to, what to do for my kid today. But there is, the international data is also, and I do want to say that this is a really difficult year, but it's also been for scientists one of the most open kind of time where people are sharing data and information and open source, publications, even journals that typically have a firewall. They're making all their articles available for free to everyone. So there has been this revolution for open, transparent information, recognizing that our knowledge base is changing every day. So what we say today may actually change in 6 months. And that's unfortunate. And, we don't want you to not trust us. We are giving you the best advice we can based on what we know today, and that might change. And so patience and recognizing that is the reality, everybody's still learning, means, that it's more complicated to give good advice all the time.
Okay, so speaking of parents with complicated decisions to make, there's a parent who would like to know what you can tell them about children with asthma. Any additional precautions that they should take given that their unvaccinated child has asthma?
I hate to say this, but you have to talk to your pediatrician. So I would say, using masks when they're indoors for sure. If you think your kid's going to be in a risky situation and your kid uses an inhaled corticosteroid like Flovent or Pulmicort, maybe it's time to start so they have a little bit of increased protection from their asthma. But I think your pediatrician would let you know how severe is this asthma? If this is persistent asthma, severe persistent asthma, maybe your child needs to engage in a lot fewer indoor activities.
There's also a more general question, and this is hard to answer, but there's a question about, in general, guidelines for unvaccinated children with underlying disease. I recognize that obviously is going to depend on the disease and the severity of the disease, but if you all could comment more generally on children who are either immunosuppressed or maybe some common underlying diseases that you encounter frequently in your practices, what kind of advice you would give, other than obviously need to talk to the pediatrician about the specific scenario, but what kind of context you could provide to those parents?
I can start, and then Dr. Gordon and Dr. Linos. The first thing foremost, make sure all the eligible adults and teenagers around that child are vaccinated. So you want to start with that, and then the second, the other thing is avoiding high risk situations, which would be places with poor ventilation, avoiding going out to indoor restaurants, things like that, which would put you at a higher risk for getting COVID. If they have to be outside, spending time as much outside with the child as opposed to spending more time indoors, especially with other unvaccinated or people that are strangers, right? So that would be avoiding making sure that they don't go to indoor restaurants, avoid other high-risk activities, whether that could be indoor pools, water parks that we were just talking about earlier, or auditoriums, or where they could encounter a lot of adults. So that would be a situation that I would say that we would recommend avoiding. And then going back to talking to the pediatrician again, depending upon what kind of chronic medical condition they have, what level of immunosuppression they have, and what is little bit risk that child can take, because also we don't want to make that child homebound either. You want that child to spend time outdoors. Now with the weather being nice, they can spend as much time outdoors as they can, with a limited group of friends that the families already know, right? With masking and social distancing, would be a situation. I would again avoid travel in situation like that, or talk to your pediatrician if you really have to travel, and other public spaces that are indoors.
I think that I agree with Dr. Sabharwal, and I would say immune suppression is, it's not just one thing, there's severities. So I think if the child is severely immune suppressed, for example, just had a bone marrow transplant, everybody should be vaccinated and everybody should be wearing masks when they go out. The risk to that child of severe problems if they get COVID is high. On the other hand, if the child has a condition that's being called at risk, such as obesity or say mild asthma, I think the risk is lower, especially since we have very little transmission right now in Massachusetts. So I think that you can be a little bit more flexible in what you're doing. So it depends on how immune suppressed your child is.
Okay. So in addition to parents concerned about the health problems their children may already have, they're also concerned about whether they would acquire health problems if they were infected with COVID. And so one parent is asking, what do we know about long COVID? And in particular, what do we know about it in children?
I think the answer is not, we don't know that much about long COVID in children, because there hasn't been a lot of long COVID in children. But long COVID is still is a disease that is manifesting and being discovered and being researched as we speak. So it looks like this is a disease that's really like an immune kind of misfiring, like your body's kind of doing this immunologic thing. And it looks like postural orthostatic tachycardia syndrome and other syndromes that are already well known. But I would say it hasn't been showing up as much in children. But the answer is we really don't. We don't know. I don't know. Maybe Dr. Sabharwal sees it more in her hospital.
No, I agree with you, Dr. Gordon. I mean, it's definitely a known entity now amongst adults, and it's being researched right now. And there are clinics in most hospitals where we have a post-COVID or long-term COVID, where you can see manifestations, whether they could be neurological, cardiac manifestation, hematological manifestations, and of course, related to infectious diseases as well. And what I can tell you, most of these infectious, the long-term COVID, somebody who had severe illness or was in the ICU for a prolonged period, those people are more at risk. Not that the people with even mild disease are now, there's small proportion who could be at risk of long COVID as well. And again, we don't know, we are learning, we don't know what genetic makeup, what their underlying immune system, what predisposes them, somebody to develop asymptomatic disease, somebody to develop, severe disease, or somebody to develop long COVID. There is maybe one or two publications that just came out where there was a concern that there was some long COVID in children as well, but that cohort was mostly older kids, teenagers, who are now getting all the vaccines. And of course, I think most of the parents have known about what we know. I won't call it long COVID. It's a sequel. It's like some of the children can develop what we call MISC, which is multi-inflammatory syndrome in children, where they can have prolonged fevers with either rash or heart problems, or they can have blood pressure problems, or abdominal problems. They can have prolonged diarrhea, and some other manifestations that they need to come in hospital. And again, we don't know which kid will develop multi-inflammatory syndrome. And what we know is we have therapy for it. So most of the kids, even in spite of them developing the disease or getting hospitalized, do well.
Okay, I just wanted to remind participants, I don't have a way to let you talk, those of you who are attending. So I see a couple of raised hands. If you have a question, we would love to hear your question, but please type it into the chat, and then I'll be able to see it. So if you could please, if you have questions, please go ahead and type them into the chat. We do have a few more questions. So one participant says they're breastfeeding their infant and hoping that the baby is getting the antibodies, because there has been some recent research suggesting perhaps some transmission of antibodies through breast milk. And so the participant is wondering whether there would be any benefit to giving the pumped breast milk to school-aged children before they go back to school in the fall. Any thoughts on that? On whether there might be a way to transmit antibodies?
Again, we don't know what protective level of these antibodies are. What has been studied is that they've looked at breastfeeding moms, and then they've looked at antibodies in the infants. And of course, whoever asked the question is correct in terms of there is transmission of antibodies from the mothers who have either had COVID disease or they were vaccinated during pregnancy. Now the guidelines are to immunize even pregnant women with the COVID vaccine, that there is some transfer of breast milk, but we don't know if those antibodies are protective, and what that threshold of that antibodies should be to protect a child, an older child per se. I think that's what they're asking. So I would say that there are no guidelines or recommendations around that. What we know is we tell postpartum women to continue breastfeeding their infants. If they have had COVID or they have had the vaccine, there is no contraindications to it. I'm not sure about the benefit that a school-age child will get from express breast milk.
I have to agree in that the antibodies that are present in the breast milk are short-lived. They are not going to stimulate the baby or the child to make their own immune response. So it's a very passive form of immunity. So as long as those antibodies from the breast milk are circulating in the baby, which is not very long, there's some protection. So I think it needs to be looked at that way. On the other hand, it's not harmful to give your school-age child breast milk. It's not going to be harmful. So if you wish to do it, it's probably okay, but you should know that the benefit is probably very tiny.
Okay, so I want to check in about vaccination. So many parents on this call are very eager. Anyone who picks to come to a forum on what to do about your unvaccinated children is very eager to get their children under 12 vaccinated as soon as possible. And so one parent is asking, is there any mechanism to get your child vaccinated before they're actually 12, children who are almost 12?
No, there is no licensed vaccine. You know, the vaccine is licensed for 12 years and older. So the day the child turns, you know, their 12th birthday, they can get it. The only other thing we were earlier talking about that actually is for certain children who are in clinical trials, either Moderna or Pfizer clinical trials, the 5 to 11-year-old age groups, if they are part of the trial, they might end up getting vaccine, but again, they won't know whether they got a placebo, which is just salt water, or they got the real vaccine till about 6 months later.
And Dr. Sabharwal, since you are involved in the vaccine trial with this age, could you tell us a little bit more about it? I'm sure folks are very curious. If you could tell us a little bit more about what stage it's at now and kind of what to expect from the process over the months ahead.
Yeah, so, you know, the study is similar to what they did in adults. So basically, we are right now again at the phase 3 of the study where they are enrolling 4,500 children across 3 continents. So it's going to be in South Africa, Brazil, United States, and I think certain parts in UK as well. So 4,500 children, they're going to be, and the ratio, as opposed to for adults who are in the trial, remember, was 1-to-1. Here it's 2-to-1. So 2 kids will get the vaccine and 1 child will get the placebo. They're going to get, again, 2 doses. For Pfizer is 3 weeks apart, for Moderna is 4 weeks apart. And then a month after their second dose, their blood will be drawn and they will check the antibodies level. So the antibody level will tell us whether they mounted the same amount of antibodies as young adults or kids ages 12 to 15 and 16. So for the 12 to 15-year-olds, we compared it with the age group 16 to 24-year-old, and the 12 to 15 years old had great antibody response. So it's going to be a similar study where they'll look at your antibody level and see how much it was, and of course, and they monitor you for disease. So if any time a child, a study participants develop cold-like symptoms, flu-like symptoms, they use a swab and do the PCR for SARS-CoV-2 to see how many of the kids develop infection, either vaccinated or unvaccinated. So that's how they come up with the efficacy. So what happened with the 12 to 15-year-olds was that they did not see any case of all the 12 to 15-year-olds who got the real vaccine. They did not get SARS-CoV-2 infection. 2 months out, now I think they have data up to 6 months out. None of the kids in that cohort developed disease, as opposed to there were few kids who got the placebo developed disease. So it's going to be a similar kind of study that was done in the 12 to 15-year-olds, and that is going to be done in 5 to 11-year-olds. And the other thing I can tell you that the dose is going to be less than what the 12 to 15-year-olds got. Like I mentioned before, they're hoping that sometime in the fall, after giving the 2 vaccines, so since they're already getting the first vaccine sometime this week, then 3 weeks later, they'll be brought back to get the second dose of vaccine, and then a month later. So they're hoping that sometime in September, they would have data to look to check these antibody levels and to have a sense of how effective the vaccine is in this age group.
Great, thank you very much. We have one last travel question because there's an endless supply of them. So this one is, the scenario is 2 vaccinated parents and a 7-year-old are visiting their family in Oregon. Would you recommend staying with a relative where in the relative's family, 2 parents and 2 adolescent children are unvaccinated? The guest rooms are in a separate section of a well-ventilated home, and the family's trying to decide whether it's safe to stay with an unvaccinated family.
If you have a choice, I mean, if finances aren't the issue here, I would stay elsewhere. I mean, not because, just because if both parents are unvaccinated and both kids are unvaccinated, that probably says to me something about this family not wanting to follow public health guidance. So I wouldn't trust necessarily everything around this family's behavior. And I'm being a little harsh here, but because there might be other reasons why they've chosen to be unvaccinated. But for me, this would signal that they may be eating in restaurants, doing other kind of high risk activities. And therefore, not only are they unvaccinated, but chances are they might also be at increased risk. And so if I really wanted to, if I was traveling to Oregon in order to visit them, I would limit my visitations outdoors and stay somewhere else. Now, that takes a level of privilege, you know, that you have the finances to stay at a hotel or something else. And, you know, that's not the case for everyone. So if you are going to stay at that house, don't do meals indoors. But it's hard if you're a guest at somebody else's house to put restrictions on like where you're eating meals. So in that scenario, I would even consider whether I would travel. I would really need to understand why that family hadn't vaccinated.
Great. One question about time frames. Are there estimated time frames for when children under age 5 might be eligible for the vaccine, and are trials underway currently for this under 5 age group?
No, not yet. As it's a de-escalation study. So we started with the adults and we went to teens. Now we are doing elementary school kids. Then it's going to be, you know, preschoolers. Not to my understanding, but they're hoping to start them soon in fall. And what I've heard is like they're hoping by next year, but I don't have a date for when the vaccine for the preschoolers might be available.
Great. Well,
because it's going to go down to 2 to 5, and then 6 months to 2 years.
Okay, so 2 to 5 year olds will be the next age band.
Yes.
The real infants. Well, thank you so much to all of our participants for your many questions in the chat and that were submitted ahead of time. And I want to just take a minute to see if there are any closing thoughts that you all want to leave our families with. Dr. Linos, is there anything you'd like to say to wrap up?
You know, thank you for being here. And, you know, we hope that the summer is going, you know, as long as rates stay pretty low in Brookline, enjoy the summer and, you know, brace for changes in the future. But it's, yeah, thank you for being here tonight with us.
Dr. Gordon?
Well, I echo what Dr. Linos said. I'm really grateful that people in Brookline are interested, and there's so many caring parents, and I hope that people can enjoy outdoor activities with their family this summer, and we can have a more normal life.
Dr. Sabharwal?
Yeah, I echo, thank you. And I want to wish all the families a happy summer so they can have a fun, enjoyable, safe summer. And I'll just put in a plug for vaccination. You know, our numbers are pretty low as compared to some of our neighboring towns, whether it's Newton, Needham, or Lexington. So if you know of adults who are either unvaccinated, please tell them to go ahead and get the vaccine. Now, most of the vaccination sites, you don't even need an appointment. It's just a walk-in. And then the governor just issued for patient or people who are homebound, if you don't want to travel or cannot travel for whatever reason, give them a call. They'll come to your house and vaccinate you.
Okay, Dr. Natalia Linos, Dr. Rosemarie Roqué Gordon, and Dr. Vishakha Sabharwal, thank you so much for sharing your expertise with us this evening. It's really a privilege to us as Brookline parents to get to have this kind of direct line and information. And I want to turn things over to Ben to wrap us up.
Yes, I just wanted to say the same thing. Thank you. Everybody said thank you. I thank you all for joining us. Thank you, Amanda, for moderating. That was wonderful. Thank you, everyone, for joining us. I wanted to thank our ASL interpreters, Rachel Judelson and Roxana Sylvia. Thank you so much for making this talk accessible. And I think that was it. Sorry, I think, no, I think it was great. And I really hope this was helpful to everyone. I know that this is, you know, I have 2 children under 12, and this was all very interesting to me because, you know, like all of you, we're making these decisions for ourselves about how to proceed with the summer and all of this. And it was just great to hear all of your thoughts and ideas on so many different questions and so many particular questions and more general questions. It was really great to kind of get some really great, you know, insight and to have all of your experience, you know, for all of you to bring your experience to bear on these questions. So thank you again. And I'll leave it to Lauren to finish up.
Thanks, Ben. Thank you to all of our panelists and to Dr. Amanda Tarullo for moderating, navigating the sea of a huge variety of questions. I think what a lot of us could say about this evening is I think our experts would agree that this is not just about science, it's about this very amorphous concept of risk tolerance. And I think I'd like to close with just the thought that as parents every day, we are dealing with some level of risk tolerance. You know, if your kid says, "Can I ride my bike to the park?" You know, and you haven't let your child ride his bike to the park you know, for the first time, you know, you think, okay, he's wearing a mask. I mean, not a mask, he's wearing a helmet. You know, he or she's wearing a helmet. You know, is this a level of risk that I'm comfortable with? Yes, people text and drive. So, you know, COVID is an animal unto itself. It's one of the scariest things we've probably all dealt with. But what I try to keep in mind is I'm making these risk assessment and risk tolerance decisions all the time. And I think that's something that's come through loud and clear in addition to the science. So thank you all. The BPO will have a recording of this available in the next, 48 hours, Ben? And we will be emailing it to registrants who would like it. And please feel free to reach out at any time at brooklineparents.org. And thank you. We plan to be having another event soon, and we will keep you posted. Thanks again. Good night.